What's up, you guys? My name is Miguel, fellow Xray Tech here, giving you your daily dose of radiation. In today's video, we are covering the different kind of X-ray exams that are performed in the ICU. So to give you context, I am a night shift X-ray tech, been doing it for about 4 years. So the ICU is considered to be the most intense unit out of all the departments of the hospital, followed maybe by surgical ICU. That could be maybe a little bit more. It all kind of depends, because people are getting fixed and they're coming out and they're all cut from the surgery and they're trying to recover and waking up. So they're both, you could say, within the same realm of like high intense, right? So for the most part, we usually just do chest. We have a set amount of morning portables that we get at midnight, and we kind of do mainly chest. We do some NG tubes, which are KUB. Sometimes you can get it with a upper chest X-ray. Sometimes, depending on if you have, it's mainly the residents that will order this. They'll start looking into like the wrists. You have maybe occasionally do some wrists, you'll do some feet, maybe some hands, but usually they're just two views. But usually it's the resident. Most doctors don't order that. They're focused on other stuff. The residents, I've noticed, are the ones who will order all the tinier, like they'll focus on all the tiny stuff versus like the big picture, because like to this day, none of the head doctors that run the ICU ever order anything like that. They'll always order chest, a KUB, and then occasionally you'll have, like, if they go to surgery or maybe they're like trying to check some like hardware, you may have to do like a lateral C-spine to check something like that, or like a lateral, well, maybe more like a cross table L-spine if they have to check for like if they have a stimulator inside their spine occasionally. But usually they'll CAT scan that, but certain doctors or residents would rather just get a still image and they will order an X-ray. But usually all the other exams that they'll need, they'll just do CAT scan, because it is way easier, because they literally, getting them to the CAT scan department is not easy at all. It takes like the nurses rush, it's quite a journey, but once they're actually laying down on the tube, they can just scan and they don't have to move. So majority of the times they will just CAT scan all the other stuff. We'll just do the basic. Same thing kind of goes for surgical ICU. But sometimes you may have to do a little bit more spine stuff, like just post-op, like shoulders, post-op, like whatever hardware they got done, you may have to do that. And it all kind of depends on what kind of surgeons or what kind of orthopedic doctors we've had here. Like in the past 4 years that I've been working at my hospital, it's been fine. Like the first 3 years of me working there, it's been fine. And then out of nowhere, we've gotten certain like spine doctors or ortho doctors that are very, how's the word? They like stuff done a certain way, or they'll go against the protocol, or they'll do stuff that we will have to involve our manager with, because we don't do that, or we don't even have the equipment to do some of these stuff. So like it can really be from like just an easy chest KUB to, if you have certain more in the daytime, but even at nighttime sometimes we get dragged into it. If you have certain surgeons or certain orthopedics or spine doctors that are a certain way, they'll order certain stuff. It makes your job a little bit more harder. It's nothing impossible. It's just, it can get redundant to when the patient is maybe not in the most optimal condition or position, or sometimes even the room to get the picture, and they want it a very true lateral, and you're like, well, this is the best I could do, and it gets back and forth, and it sometimes can get ugly, and sometimes the upper management has to be involved, but that doesn't happen on a regular basis. I don't want to scare anyone who. I'm just giving you the insight I wish someone would give me, because I know a lot of people don't talk about it, and as a student you really don't see it majority of the times when you'll go to these places. Those are more 2-minute jobs. Usually if they're going to take a student up to the floor, it'll just be for a chest x-ray or KUB, and you'll just have to be, the tech will just kind of be monitoring you to make sure you don't hit any wires, because there is a bunch of wires, a bunch of like medicines that these patients are on, or a bunch of like, sometimes they're on some neuro stuff, like the neuro monitors, which has the patient, like, you can't move them a certain way, or they'll have like a little pump where you have to roll them. There's a lot of variables that comes involved once you go into the ICU. Now, like, I don't have to stop and think, because I've done it so long that I can just see it, and I look at my partner and we already know what to do. Obviously, if you're new to it, you may have to ask the nurse every single time, or like it'll take a little bit longer than normal, but it all just kind of takes time. So yeah, it's been your boy Miguel. We'll see you on the